quickly and quietly.
What a day.
Prime Minister, please.
Mr. Speaker, with permission, I will make a statement on our progress against Omicron and the review of our Plan B measures. Within hours of learning from scientists in South Africa about the emergence of a new COVID variant last November, this government acted, introducing balanced and proportionate restrictions at our borders to slow the seeding of Omicron in our country. As we learned more about this highly transmissible new variant, we implemented the Plan B measures we had prepared precisely in case our situation deteriorated, encouraging people to change their behaviour to slow the spread of the virus and buying crucial time to get boosters into arms. We made the big call to refocus our National Health Service, necessarily requiring the difficult postponement of many other appointments so that we could double the speed of the booster programme. And thanks to the extraordinary efforts of our NHS and its volunteers, we delivered the fastest booster programme in Europe, reaching half our population before any other European country, with more than 36 million boosters now in arms across the UK, including more than 90% of all over 60s in England. And taking a balanced approach, we resisted calls from others to shut down our country all over again. Many nations across Europe have endured further winter lockdowns. Many have seen hospitality curfews and nightclubs closed, capacity limits at sports stadiums, the return of social distancing, and in some places, Christmas and New Year as good as cancelled. But this government took a different path. We kept England open, and we supported those businesses which faced reduced demand because of the response to Plan B measures. And while we must continue to remain cautious, the data are showing that time and again this government got the toughest decisions right. Today's latest ONS data show clearly that infection levels are falling in England, and while there are some places where cases are likely to continue rising, including in primary schools, our scientists believe it is likely that the Omicron wave has now peaked nationally. There remain, of course, significant pressures on the NHS across our country, and especially in the North East and North West. But hospital admissions, which were doubling every 9 days just 2 weeks ago, have now stabilised, with admissions in London even falling, and the numbers in intensive care not only remain low but are actually also falling. So this morning, the Cabinet concluded that because of the extraordinary booster campaign, together with the way the public have responded to the Plan B measures, we can return to Plan A in England and allow Plan B regulations to expire. As a result, from the start of Thursday next week, mandatory certification will end. Organisations can, of course, choose to use the NHS COVID Pass voluntarily, but we will end the compulsory use of COVID status certification in England. From now on, the government is no longer asking people to work from home. And people should now speak to their employers about arrangements for returning to the office. And having looked at the data carefully, the Cabinet concluded that once regulations lapse, the government will no longer mandate the wearing of face masks anywhere. Mr. Speaker, Mr. Speaker, from tomorrow we will no longer require face masks in classrooms, and the Department for Education will shortly remove national guidance on their use in communal areas. In the country at large, we will continue to suggest the use of face coverings in enclosed or crowded spaces, particularly when you come into contact with people you don't normally meet, but we will trust the judgment of the British people and no longer criminalise anyone who chooses not to wear one. The government will also ease restrictions further on visits to care homes, and my right honourable friend, the Secretary of State for Health and Social Care, will set out plans in the coming days. Mr. Speaker, as we return to Plan A, the House will know that some measures still remain, including those on self-isolation. In particular, it is still a legal requirement for those who have tested positive for COVID to self-isolate. On Monday, we reduced the isolation period to 5 full days with 2 negative tests, and there will soon come a time when we can remove the legal requirement to self-isolate altogether, just as we don't place legal obligations on people to isolate if they have flu. As COVID becomes endemic, we will need to replace legal requirements with advice and guidance, urging people with the virus to be careful and considerate of others. The self-isolation regulations expire on the 24th of March, at which point I very much expect not to renew them. Indeed, were the data to allow, I would like to seek a vote in this House to bring that date forwards. In advance of that, we will set out our long-term strategy for living with COVID-19, explaining how we hope and intend to protect our liberty and avoid restrictions in future by relying instead on medical advances, especially the vaccines, which have already saved so many lives. But to make that possible, we must all remain cautious during these last weeks of winter. When there are still over 16,000 people in hospital in England alone, the pandemic is not over. And Mr. Speaker, make no mistake, Omicron is not a mild disease for everyone, especially if you're not vaccinated. Just look at the numbers in intensive care in other countries where vaccination rates are far lower. Indeed, from our NHS data, we know that around 90% of people in intensive care are not boosted. So I urge members across the House to do everything possible to encourage any remaining constituents who have not done so to get boosted now. And for the next few weeks, I encourage everyone across the country to continue with the behaviours that we know help to keep everybody safe. Washing hands, letting fresh air in, getting tested, self-isolating if positive, and, as I say, thinking about wearing a face covering in crowded and enclosed settings. Mr. Speaker, Omicron tested us just as Alpha and Delta did before. But let's remember some of what we've achieved. We were the first nation in the world to administer a vaccine. We were the fastest in Europe to roll it out, because outside the European Medicines Agency, this government made the big call to pursue our own British procurement strategy rather than opting back into the EU scheme as some people urged. We created a world-beating testing programme, the largest in Europe, Mr. Speaker, and procured the most antivirals of any country in Europe too, because this government made the big call to invest early in lateral flow tests and in cutting-edge drugs to protect the most vulnerable. We've delivered the fastest booster campaign in Europe, and we are the first to emerge from the Omicron wave, because the government made the big call to focus on our NHS and to refocus our activity and lead that campaign to get boosted now. And that's why we've retained the most open economy and society anywhere across the European continent and the fastest growing economy in the G7. Because we made that tough decision to open up last summer when others said that we shouldn't. And to keep things open over the winter when others wanted them shut, Mr. Speaker. This week, the World Health Organization said that while the global situation remains challenging, the United Kingdom can start to see the light at the end of the tunnel. And, Mr. Speaker, this is no accident of history. Exactly. Confronted by the nation's biggest challenge since the Second World War and the worst pandemic since 1918, any government would get some things wrong, but this government got the big things right, Mr. Speaker, and I commend this statement to the House.
Keir Starmer.
Thank you, Mr. Speaker, and I thank the Prime Minister for advance sight of his statement. Throughout the pandemic, the British public have made enormous sacrifices to limit the spread of the virus, staying at home, social distancing, and, unlike the Prime Minister, cancelling parties. I would like to thank everybody who has followed the rules. I'd like to thank the NHS staff and volunteers who've rolled out the booster jab. The Labour Party does not want to see restrictions in place any longer than necessary. We will support the relaxation of Plan B as long as the science says that it is safe. So can the Prime Minister share the scientific evidence behind his decision and reassure the public that he's acting to protect their health, not just his job? The 438 deaths recorded yesterday are a solemn reminder that this pandemic is not over. We need to remain vigilant, learn the lessons from the government's mistakes. With new variants highly likely, we must have a robust plan to live well with COVID. So where is it? He's too distracted to do the job. And it's not just the Prime Minister who's letting us down. Where's the Health Secretary's plan to prepare for another wave of infections? Why isn't the Chancellor working with British manufacturers to shore up our domestic supplies of tests? Where is the Foreign Secretary's plan to help vaccinate the world? They're all too busy plotting their leadership campaigns to keep the public safe. While the Conservative Party tear themselves apart, jostling for position, looking inward, the Labour Party is focused on the national interest, filling their void. We have a plan that the Prime Minister doesn't. We would train and retain a reserve army of volunteer vaccinators. We will build a supply of test kits made in Britain to protect us from global shortages. We would raise statutory sick pay and make all workers eligible. Keep schools open by improving ventilation. Break the endless cycle of new variants by playing our part in vaccinating the world. We would produce a roadmap for decision-making to ensure efficient action when it's demanded. We'd stop the short-sighted sell-off of the UK's vaccine manufacturing centre, and we would never again allow our NHS and social care service to be so run down and underfunded, understaffed and overstretched as it has been over the last decade of a Tory government. Mr. Speaker, Labour has a plan to live well with COVID and secure our lives, livelihoods and liberties. Where's his?
Well, Mr. Speaker, I'd be happy to share the scientific advice on which we've taken this decision, of course, and he conceded it's there for everybody to consult. But he asks about our testing abilities, Mr. Speaker. We're conducting about 1.25 million tests a day. We have the biggest capability to do tests of any country in Europe. We've built, as I promised the House, Mr. Speaker, and he attacked me at the time. I said, well, we have a world-beating testing industry, a massive diagnostics facility, which we never had before. He attacks the government over the distribution of vaccines to the rest of the world. We've already done 30 million. We'll do 100 million by June, Mr. Speaker, and 2.5 billion AstraZeneca vaccines have been distributed around the world, thanks to the deal the UK government did with AstraZeneca, so that those vaccines are distributed at cost price. He talks about funding the NHS. That party, Mr. Speaker, voted against the funding that we're going to need to clear the COVID backlogs and fund our NHS. Mr. Speaker, throughout this pandemic, he has been absolutely shameless in veering from one position to the next, and he has been wrong. He has been wrong about virtually every single important decision. He was wrong about keeping schools open, Mr. Speaker. Do you remember he consistently refused to say that they were safe because of what his paymasters in the union were telling him? He was wrong about going forward from lockdown in July, on July the 19th. He said it was reckless. Do you remember, Mr. Speaker? He was totally wrong. He was wrong about, the Labour front bench were wrong about going through Christmas and New Year with Plan B, as we did. They said we needed a roadmap back to lockdown. He did. That guy did. Oh no, wait, it was Ashwin. Maybe it was you. That guy. They said they wanted a roadmap back to lockdown, Mr. Speaker. At every step, and above all, Mr. Speaker, they tried to undermine the vaccine task force and to say that you could not spend money. They said you should not be spending £675,000 of taxpayers' money on outreach to vaccine-hesitant groups. That's their idea of priority spending, Mr. Speaker. He has been, it's been absolutely miserable listening to the opposite bench because they have had nothing useful to say. They have flip-flopped opportunistically from one position to the other. And, Mr. Speaker, did you get any idea from what he said just now whether or not he supports what we're doing? No. he does support it. Okay, he supports it this week, Mr. Speaker. But what you can be certain of, Mr. Speaker, is that if he thinks that there's any political opportunity in opposing it next week, he won't hesitate to do so. He's been Captain Hindsight throughout, Mr. Speaker. Captain Hindsight, and he's had absolutely nothing useful to say or to contribute.
Lisa May.
Thank you, Mr. Speaker. I refer the House to my entry in the Members' Register. Can I say to my right honourable friend that many of my constituents work in the aviation sector? I welcome the announcement he's made about Plan B restrictions today, but I note he made no reference to the tests that are still required for people coming into England. If we're going to learn to live with COVID, we need to facilitate travel. So will he take this opportunity to announce that when Plan B restrictions are removed next week, the government also make it clear that there will be no test requirements for anybody entering England who is fully vaccinated?
I thank my right honourable friend. We're certainly reviewing the testing arrangements for travel, and my right honourable friend, the Secretary of State for Health, will be making a statement in the next few days on that, Mr. Speaker. But I think it's very important that everybody in the country understands that getting your booster, wherever you want to go in the world, getting your booster is going to be a pretty crucial thing to do.
We now come to Ian Blackford.
Thank you, Mr. Speaker, and I thank the Prime Minister for advance sight of his statement. We're all grateful that the data suggests that we've turned a corner in the Omicron wave, and that the success of the vaccination programme in particular gives us cause to be hopeful in the months ahead. But though declining, the level of infection is still undoubtedly high, and the NHS remains under pressure. That is why caution is the key, rather than the PM strategy of throwing caution to the wind. Baseline measures of face coverings and indoor public places and working from home where possible, which Scotland still has in place throughout, are extremely important in the weeks ahead, as is the guidance on lateral flow test. So will the Prime Minister guarantee, and maybe if he can come off his phone because this is important, so will the Prime Minister guarantee that lateral flow tests will remain free as they are required, and put to bed speculation that they will be removed free at the point of need? But, Mr. Speaker, while the data gives us cause to be optimistic, the real problem for the Prime Minister is that no matter what the data has said today, he had no choice but to throw caution to the wind. The pathetic and unbelievable excuses that he doesn't know his own rules have left the Prime Minister weak. The Prime Minister is unable to lead on this issue or on any other, and the public can't trust a single word that the Prime Minister says. Any shred of credibility has gone. In a global pandemic, which is what the World Health Organization is cautioning, is nowhere near over, and during which new variants are likely to emerge, it is deeply concerning that we have a Prime Minister like this at the helm who simply is not fit to lead. And even though, thankfully, the figures give us cause to be hopeful, it's clear that the Prime Minister cannot carry on when his credibility has all gone.
Prime Minister.
Well, Mr. Speaker, I repeat the points I made earlier on to the right honourable gentleman, and I think that the whole effort, the reason we're in the state that we are, is because of the immense cooperation there's been across the whole of the UK. He talks about testing, and of course we'll keep lateral flow tests free for as long as is necessary. But testing has been a fantastic example of union collaboration. I've seen for myself and tests being been assessed in Glasgow that were coming from people in Sussex. It's been I've seen the work of the UK Armed Services helping people across the whole of the UK to move people who needed treatment to wherever. It has been a fantastic example of union collaboration. I hope he bears that in mind.
Absolutely. We now come to the Chair of the Select Committee, Jeremy Hunt.
Thank you, Mr. Speaker. At the height of the first wave, this government had the courage to pre-order 400 million doses of vaccine without even knowing if they worked, and that has laid the foundations for us having the best vaccine programme of any large country. So I welcome today's announcement. It won't surprise the Prime Minister, though, if I draw his attention to the fact that NHS doctors and nurses are absolutely shattered. He will have seen this week that 1 in 6 doctors say that they have had near misses or harmed patients because of exhaustion. So if he doesn't want to accept the Select Committee's recommendations to address the workforce crisis, what will he do to give hope to our brilliant frontline staff?
First of all, Mr. Speaker, I want to, my right honourable friend has a great deal of expertise in this matter. I want to thank everybody in the NHS, all staff, frontline and all staff for what they've been doing. And I know he's right of what he says about how tired people are. They're exhausted, Mr. Speaker, but they're also working heroically and doing an incredible job. And it's because there are 17,000 COVID cases that, as I said, we've got to remain cautious. In spite of what the gentleman opposite was saying, we do need to remain cautious, and we need to make sure that we continue to recruit for our amazing NHS. There are now 44,000 more healthcare professionals, Mr. Speaker, than there were in 2020, and that's as a result of the recruitment by this government.
Thank you, Mr. Speaker. We know that the vaccine still remains one of the best defences against this virus, but over the past month we have seen a slowing in the booster vaccination rate. So can the Prime Minister update the House as to when he expects a completion date for the booster vaccination, but also can he set out a plan as to how he is going to encourage take-up of the vaccination among certain groups, particularly young people?
Prime Minister.
She makes an incredibly important point, and I'm grateful to her, because there is a job of work for all of us to do in reaching out to groups who and it's, at the moment it's not actually hesitancy, it's more apathy that's the problem. It's because Omicron is seen wrongly to be a mild disease, that people are not getting the vaccine in the way that they might. And we need to break down that apathy with those groups, and we're doing everything we can to do that. The numbers are rising the whole time, but we want them to rise faster.
Andrew Lutz.
Thank you, Mr. Speaker. You would think that today of all days, opposition benches could be delighted for our great United Kingdom. Delighted that legal restrictions could come to an end soon. Delighted about the amazing vaccine rollout, and delighted about the strength of our economy. All a superb team effort led by my right honourable friend. But can he reassure me that in the work that looks post-fact, that he will very carefully assess the lockdown impact on people having babies, and in particular those who were separated from their partners, who were unable to take part in the birth experience with them, which is so vital for giving every baby the best start for life?
Prime Minister.
Can I thank my right honourable friend for what she has just said, and her point about birth partners being able to attend is unbelievably important, and I'm glad that we were able to address it in spite of some difficulties. And her Early Start for Life programme is unbelievably important, and I know that both my right honourable friend for education and for health are working with her to deliver it.
Dave.
Speaker, yesterday the Prime Minister had to accept that he was unaware of what his own COVID rules actually allowed. With millions of British people now seeing that the Prime Minister can't even grasp what his own basic rules are, he's no longer a credible person to set the rules for others during this public health crisis. Isn't it time he accepted that the House and the country can no longer trust him with the nation's health? And the best policy to beat COVID now will be for him to resign.
Prime Minister.
Mr. Speaker, ni hao. As we say to the right honourable gentleman, 人心里很高兴. Mr. Speaker, I don't agree with him. I want to go on and deliver on the people's priorities. This government was elected with an enormous mandate to unite and level up across our country, and that is what we're going to do.
Mark Harper.
Thank you very much, Mr. Speaker. I hope the Prime Minister will forgive me for not being extraordinarily grateful for the withdrawal of these measures. I and many colleagues on these benches didn't think they were necessary in December, but I do nonetheless welcome their removal. Can I draw his attention to a further policy which I think it would be helpful if he reconsidered? The government's current plan is to say to our valuable NHS staff that if they refuse to be vaccinated, they're to be sacked. And those sackings are to commence in a couple of weeks' time with no compensation. We know, and we know now, that the Secretary of State is being advised by his own officials due to the lack of protection against transmission, that this needs to be rethought. Can I urge the Prime Minister to rethink this policy? We shouldn't reward our NHS staff for all their dedication with the sack. We should allow them to continue in the valuable work that they deliver to our great country.
Minister.
I thank him very much, and I respect very much the points of view that he's put across consistently throughout this pandemic. And it's been very important that we've had a voice speaking up for freedom in the way that he has. But I have to think also of those who will be at the bedside of elderly and vulnerable people who are dying of nosocomially acquired COVID, and their feelings about our failure to get vaccination rates up high enough within the NHS. And it's a very, very grim problems. I'm sure he can understand, Mr. Speaker. And nobody wants to have compulsory vaccination, but since the policy was announced, rates of vaccination within the NHS have gone up notably, and that's a positive thing. We will reflect on the way ahead. We don't want to drive people out of the service, but it is a professional responsibility of everybody looking after the health of others within our NHS to get vaccinated, and I hope he agrees with that.
Wayne David.
Does the Prime Minister agree with me? But unlike someone who attended bring your own booze parties, the Welsh First Minister Mark Drakeford has behaved with decency and integrity throughout this entire pandemic.
It's certainly been. I think the collaboration across England, Scotland, Wales, Northern Ireland has been exemplary, and I've enjoyed working with our partners and will continue to do so.
Edward Timpson.
Very much, Mr. Speaker. I refer honourable members to my entry in the register. And can I thank the Prime Minister for his statement today, and particularly the decision to now remove face masks from schools. I know many children and staff, pupils and parents will be extremely pleased that is now happening. But I know he will also share my concern, and that of the Children's Commissioner, Dame Rachel de Souza, that during the pandemic we've seen many thousands of children who have become off the radar of schools, off school rolls. And particularly the most vulnerable children, this causes serious problems about their exposure to crime and exploitation. So will he look again at some of the recommendations in my review of school exclusion to try and address this, so that we can track every pupil who is of a school age? Because we should have as a basic principle knowing that every child is in school, where they're in school, and what their future is to be.
Mr. Speaker, my honourable friend is an expert in this, and he's spot on in what he says. I don't want to see excluded kids being you're locked in a cycle of ever-growing deprivation. He's absolutely right. The best place for kids is in school. That's why we worked so hard to keep schools open and to insist that they were safe.
Caroline Lucas.
Thank you, Mr. Speaker. I was listening carefully to the Prime Minister's statement. I don't think he mentioned long COVID once. Yet, according to the ONS, over 1 million people are living with this debilitating condition. Yesterday, the all-party group on coronavirus heard heartbreaking testimony from frontline NHS workers who are living with long COVID and many of whom cannot return to work because of this condition. Will he now commit to formally recognising long COVID as an occupational disease and launch a compensation scheme for frontline workers who are left unable to work after catching COVID whilst on the front line of our pandemic response?
Prime Minister.
I thank, and I really understand the concerns of people with long COVID. Everybody knows people who've had an experience with COVID that has gone on far longer than many others, and who've had a genuinely debilitating time. And we are looking at it. The research continues, and we will do whatever we can to support people with long COVID. But there's a deal of work still to be done.
Let's have the most exciting man, Sir Desmond Swain.
Thank you. Can I welcome wholeheartedly the announcements that have been made today? And I would ask the Prime Minister to review again the need to sack domiciliary workers and NHS workers, and to examine that evidence that suggests that they pose a risk to their statements, when our belief is that they won't any more than unvaccinated?
Prime Minister.
I thank him very much, but I think the evidence is clear that healthcare professionals should get vaccinated.
Thank you, Mr. Speaker. The rush to remove the requirement for masks, including on public transport, will cause people to fall ill and die unnecessarily. Isn't this all about saving the Prime Minister's political skin, not about protecting public health? What a moral failure and what a bad way to go.
Minister.
Well, Mr. Speaker, I notice that he's at variance with his front bench on that point, not for the first time. I don't think he's right. I think we should trust to the judgment of the British people, and that's what we're going to do.
Mr. Mack.
Thank you, Mr. Speaker. I too want to welcome today's statement and the review of the Plan B measures. And like colleagues here on this side of the House, I too want to question on behalf of the 100,000 NHS workers the mandatory vaccination. Given the Chief Medical Officer told MPs that vaccinations had a minimal impact on transmission, isn't it the case now there is no reason at all for mandatory vaccinations for care workers and NHS staff? Over the last 2 years, these people have worked tirelessly on the front line, and we have clapped these key workers. Can the Prime Minister now make sure that he doesn't sack them? It is utterly unjustifiable.
Prime Minister.
I understand her point, but I must say that the NHS fully supports the policy because of out of considerations for patient safety, and I would just repeat what I've said to several members. I really think it's the duty of healthcare professionals to get vaccinated.
Adam Kazar.
Thank you, Mr. Speaker. After he called for the Prime Minister's resignation over Partygate, the branch manager of the Scottish Conservatives was referred to as a lightweight by the Leader of the House. I simply ask, how does the Prime Minister think he can maintain his position and continue to issue rules and advice on COVID when he can't follow the rules himself?
At some point you do.
Mr. Speaker, I don't agree with her with the greatest respect, and she will have to wait to see whenever the inquiry concludes. But Mr. Speaker, I think that the work on rules and guidance, which we've done together with our friends and partners in the Scottish administration, has been exemplary, and it's helped this whole country to come out of COVID faster than any other European country.
Siobhan Bailey.
Thank you, Mr. Speaker. I welcome my right honourable friend's statement today, particularly about masks, and I hope they never ever return in our schools. But sadly, it felt to many of us that were concerned about the Plan B measures that there was no learning from the last 2 years, and we've had the impact on businesses, including my beloved wedding sector, has been quite serious, with fears about the next winter already affecting bookings. Will my right honourable friend confirm that we're learning from facts and not just models to give confidence that our response to the next variant, because it will come, will be assessed accordingly?
Yes, Mr. Speaker, and if she wants to look at other European countries, I share her enthusiasm for the weddings industry and business. It's a fantastically important business, and a massive employer in our country. But other European countries, I hesitate to make this point again, Mr. Speaker, have been in a far worse state when it comes to the closures and the restrictions they've been forced to impose. I'm thrilled that we've been able to open up in the way that we have and get people married in the style and